This is Fizz. He's going to be my model for the Directional Terms assignment. So first we're going to go through the Directional Terms. So there is the sagittal plane, which divides the body into parts, but they're not necessarily equal parts. And then we have the median plane, which goes straight down the body like this, and it divides into equal parts. And then there is the transverse plane, which divides the body into cranial and caudal views. And then there is the dorsal plane that goes through the body like this, and it divides it into dorsal or ventral, and it's not necessarily equal as well. And then there is the mid-sagittal, which is the head, divides the body into equal left and right parts. So left and right, when we're talking about left and right, we're talking about the patient's left or right. So this would be his right, and this would be his left. Cranial, caudal, cranial towards the head, caudal just towards the back, dorsal, ventral, so dorsal, which is towards the back, ventral, which is towards the chest, dorsal in relation to the limbs, which is when you would see the transverse plane. So we would start it about here. So dorsal is the front of the foot, and then in the back leg, which is here, dorsal is the front part here. And then medial and lateral. So the medial of the leg, which is the outside. Nope, sorry, that was wrong. The medial is the inside, so it's closest to the body, whereas lateral is the outside, so it's away from the body. Deep, superficial. So if he had a wound, superficial would just be like under the skin or something like that, whereas deep would be deep into the body, like a puncture wound or something like that. Distal, proximal, which is when we're talking about the legs. So you start about here, which would be your plane. Distal, just away from the body. Proximal, which is towards the body. Palmar and plantar. So palmar is regarding the front, or the front foot of the back part where the pads are, and then same with the plantar. So we'd be talking about the back foot, but the bottom pad part of the foot, and then flexion and extension. So got the carpus here, so flexion, which is when we're flexing, and then extension is extending, abduction and adduction. Abduction is, I know Fizzy, you're a good boy, is when we are moving the limbs away, and adduction is when they're coming closer together. This is Moby. He's going to be my demo for the recumbency positions, as the other video cut out. So, sternal recumbency is when they are laying sternal, like so, and then lateral recumbency is when they are laying on their side, like this, and then dorsal recumbency is when they are on their back, like this, and then oblique is kind of when they're like on their side and back, sort of thing.